I think what's hard is that for people sometimes they don't want to think about young children suffering.
It's a matter of making the most of the resources that we have. The system is stretched. We know that. The DCS system is stretched. And so we're really needing to make sure that every interaction has therapeutic value. It's a very big goal, but that's part of what system of care and medical management are taking on this year.
We have had the support of Mercy Maricopa in applying for different grants that have allowed us to branch out and do pilots in Maricopa County. One of the most interesting and being well received is the project that we're doing with the Arizona Department of Juvenile Corrections to provide parent-to-parent support, a telephone assistance line, and participate with them in planning meetings. And this is giving parents the capacity to develop new skills and prepare for their child to return home or to the community. This takes a load off the parents right away, knowing they're not alone, that another parent and many other parents have walked the same journey, and that they will find answers, and there is much that can be done to help their child and their family situation.
Pay me now or pay a lot more later. So it costs a lot more to, serve an adult who has some serious mental health needs and some serious physical needs, medical needs, because of some things that happened early in their lives that were never addressed. We can spend a little bit more here and make a big difference in the long run. Our clinic serves just children birth to 5. It's been kind of a unique carve-out that we have with Mercy Maricopa, and it's something that is unique to mental health in general. It's something we've been doing for a long time. It's now becoming an increased understanding that this is really an important population to be serving. This is a high-risk population, working with young children. They usually come to us with significant traumas. Many of them have significant developmental needs, physical developmental needs, in addition to some of their emotional developmental needs given their histories. It's really hopeful. I mean, if you can make some changes now, you can make some big impact in these people's lives in the long run. And that's exciting, and that's fun, and that's one thing that we are really thankful for in terms of our contract with Mercy Maricopa. They've recognized that, and they're really working to help, I think, what I would call elevate the work in the broader community.
We don't want kids in out-of-home care, and when they are, we sure as heck don't want them out of the state of Arizona, because they're removed from everything they've ever known. And so we focused on developing services in Arizona to be able to support youth here that would be able to work with the families, work within our provider community to be able to support them here. The research shows that the outcomes are far better. It's less disruption, less trauma for the child, for the family, for the community. And we've had well over 20 where we've been able to keep in the state of Arizona. It's a lot of work, it's a lot of effort, a lot of coordination, a lot of teamwork, a lot of planning. And it's incredibly exciting when a child is able to come home and be successful here. Once we went to direct contracting with every single provider within our system, they now had a choice of, instead of 3 places to get high needs case management, they now had a choice of 9 providers. We are very excited this year to focus on outcomes. We have been putting outcomes and performance measures into contracts, and really want to focus on processes that we believe will get us to the outcomes that we want for our kids and families. We believe very confidently that it will reduce inpatient, it will reduce EDs, it will reduce out of home, it will reduce higher levels of care that are very disruptive and traumatic to children and families.
Emergency department holds definitely are of national concern. This is not something that is unique to Maricopa County at all. When I was at the American Academy of Child and Adolescent Psychiatry, meeting last year, it was a strong focus. At Mercy Maricopa, we've taken a multi-pronged approach. First of all, we have one traffic control person who is gathering all the information from all the emergency departments across the county, ensuring that gets to the team that is currently working with those youth, or enrolling them right away with our crisis teams who go out to the emergency rooms and actually enroll kids in the emergency room. So those individuals who are access eligible get very quick intakes and enrollments to help facilitate discharge. When we first began this initiative, we were having 14, 15, even up to 20 kids in an emergency room at a given time, with lengths of stay varying from 10 to sometimes hundreds of hours. At this point, we have brought our numbers down to approximately 4 to 8 children on a given evening, with our wait times varying from almost nothing up, and we have had a few outliers at about the 100-hour mark, but that has become truly an outlier, which is huge progress. So there's still a lot more work to be done, but the progress has been tremendous. When we took over last April, we had high levels of kids in out-of-state placement. We had high levels of children needing emergency rooms. So those were the outcomes that we didn't want. So we've been looking systematically first at what is there and what isn't there and filling those gaps. But part two, which is I think what we're trying to start as we move into year 2 of Mercy Maricopa, is making sure that whatever services are provided are going to give the most bang for the buck, for lack of a better term.
With the adjustment in no longer contracting with the provider network organizations, we were able to put millions of dollars back into our direct support services, into our community-based services, so that kids and families were able to receive services in their community. And we enhanced and expanded specialty services that we've seen great outcomes from.
It's really taken all of us to come to the table and brainstorm solutions. And it's been really amazing how everyone has come together around this issue.